Now we're getting into chapter 23, part 2. Because again, I said this chapter's it's a really big chapter. It's a very important chapter. So I can't stress enough to make sure you read this chapter completely. Look at all the figures, all the case studies, the highlights, the putting it all into practice, the procedures in this chapter. It's so very important. Okay, so we're going to start with the part 2 of chapter 23 on page 805, and we're going to start with the closed wounds. For closed wounds, I want you to highlight that a closed wound involves an injury to the underlying tissues of the body without a break in the skin surface or mucous membrane. An example is a contusion or a bruise. For the musculoskeletal injuries, sorry guys, I can't talk today, as you can tell with the lectures. Under fracture, in the second and third paragraph, I need you to highlight the following. In the second paragraph, highlight where it says a closed fracture, the most common type, occurs when there is a break in a bone but no break on the skin over the fracture site. An open fracture involves a break in the bone along with the penetration of the overlying skin surface. In the next paragraph, highlight where it says the sign and symptoms of a fracture include pain and tenderness, deformity, swelling and discoloration, loss of function of the body part, and numbness and tingling. Make sure to review figure 23.10. And then now we're going to start with the dislocation, sprain, and strain. For dislocation, I need you to highlight that a dislocation is an injury in which one end of the bone making up a joint is separated or displaced from its normal position. Sprain. Highlight that a sprain is the tearing of ligaments at a joint. Strain. Highlight that a strain is the stretching and tearing of muscles or tendons. Now let's go on over to page 806. Please highlight and review and become familiar with figure 23.11 for both an impacted fracture, a green stick fracture, transverse fracture, oblique fracture, comminuted fracture, and spiral fracture. On page 807 for burns, highlight that a burn is an injury to the tissue caused by exposure to thermal, chemical, electrical, or radioactive agents. For a superficial first-degree burn, highlight the following. A superficial burn is the most common type of burn. It involves only the top layer of skin, the epidermis. With this type of burn, the skin appears red, is warm and dry to the touch, and is usually painful. Sunburn is a common example of a superficial burn. For partial thickness, a second-degree burn, highlight the following. A partial thickness burn involves the epidermis and extends into the dermis but does not pass through the dermis to the underlying tissues. The burn usually appears red, molted, and blistered. In most cases, the blisters should not be broken because they provide a protective barrier against infection. Partial thickness burns are usually very painful, and the area often swells. This type of burn usually heals within 3 to 4 weeks and may result in some scarring. For full thickness, third-degree burn, highlight the following. A full thickness burn completely destroys the epidermis and the dermis and extends into the underlying tissues, such as fat, muscle, bone, and nerves. The affected area appears charred black, brown, and cherry red, with the damaged tissues underneath often pearly white. Highlight the patient may experience intense pain. However, if damage to the nerve endings is substantial, the patient may feel no pain at all. For thermal burns, highlight that thermal burns usually occur in the home, often as a result of fire, scalding water, or coming into contact with a hot object such as a stove or a curling iron. All right, now let's go into page 808. Chemical burns. Highlight that chemical burns occur in the workplace and at home. Now let's go into seizures. Highlight the following. In the first paragraph, I need you to highlight that a seizure is a sudden episode of involuntary muscular contractions and relaxation, often accompanied by changes in sensation, behavior, and level of consciousness. In the next paragraph, you'll highlight the following. Seizures are classified as partial or generalized according to the location of the abnormal electrical activity in the brain. Partial seizures are the most common type, occurring in approximately 80% of individuals who have seizures. With a partial seizure, the abnormal electrical activity is localized into specific areas of the brain. Only the brain functions in those areas are affected. If we go down a couple of more paragraphs, I want you to also highlight the following. With a generalized seizure, the abnormal electrical activity spreads through the entire brain. The best known type of generalized seizure is a tonic-clonic seizure, formerly known as a grand mal seizure. For emergency care for seizures, highlight the following. The most important criterion is caring for the patient in a seizure is to protect the patient from harm. Highlight that you do not restrain the patient. Loosen restriction clothing that may interfere with breathing, such as collars, neckties, scarves, and jewelry. Highlight that the seizure will occur no matter what you do. Restraining the patient could seriously injure the patient's muscles, bones, or joints. Poisoning. Highlight that a poison is any substance that causes illness, injury, or death if it enters the body. For ingested poisons, highlight that poisons that are ingested enter the body by being swallowed. On page 810, inhaled poisons, highlight the following. A poison that is inhaled is breathed into the body in the form of gas, vapor, or spray. The most commonly inhaled poison is carbon monoxide, such as from car exhaust, malfunctioning furnaces, and fires. For absorbed poisons, highlight that a poison that is absorbed enters the body through the skin. Injected poison. An injected poison enters the body through bites, through stings, or by a needle. On page 811 for insect stings, in the second paragraph, please highlight the following. When a honeybee stings, its stinger remains embedded in the victim's skin, causing the bee to die as it tries to tear itself away. Wasp, yellow jackets, and hornets are more aggressive than bees and can sting repeatedly. Hornets are the most aggressive of the group and may sting even when not provoked. Yellow jackets are close behind in aggressiveness, and wasps usually sting only if someone interferes with them near their nest. Spider bites. Highlight the following. Although spiders are numerous throughout the United States, most do not cause injuries or serious complication. Only 2 spiders have bites that cause serious or life-threatening reactions: the black widow spider and the brown recluse spider. And I can tell you from experience with a brown recluse spider, they do not play. I got bit by one when I was a kid. All right, let's go on over to page 812 for snake bites. Highlight the following. Species of poisonous snakes in the United States include rattlesnakes, copperheads, cottonmouths, water moccasins, and coral snakes. On the other side on page 812 on the very top, highlight that the most serious type of bite is one from an animal with rabies. Rabies is a viral infection transmitted through the saliva of an infected animal. If the condition is not treated, rabies is generally fatal. Certain animals tend to have a higher incidence of rabies than others. These include skunks, bats, raccoons, cats, dogs, cattle, and foxes. Under heat and cold exposure, highlight the following. Certain individuals are at higher risk for developing heat-related and cold-related injuries as follow, and please highlight each of these bullet points. Elderly individuals, young children, particularly infants, individuals who work or exercise outdoors, individuals with medical conditions that cause poor blood circulation, such as diabetes mellitus or cardiovascular disease. Hey, it's me. Individuals who have had heat-related or cold-related injuries in the past, and individuals under the influence of drugs or alcohol. Please become familiar with heat cramps, heat exhaustion, and heat stroke. On frostbite on page 813, please highlight the following. Frostbite is a localized freezing of body tissue as a result of exposure to cold. Also highlight that frostbite most commonly affects hands, fingers, feet, toes, ears, nose, and cheeks. Let's go to page 814. Please read over hypothermia, and under diabetic emergencies, highlight the following. In the third paragraph, you're going to highlight that there are two types of diabetes. A severe form, usually appearing in childhood, known as type 1 diabetes, and a mild form, usually appearing in adulthood, known as type 2 diabetes. If we go on to the next paragraph, highlight the following. A diabetic patient may experience two types of emergencies: hypoglycemia, commonly referred to as insulin shock, and diabetic ketoacidosis, commonly known as a diabetic coma. Insulin shock hypoglycemia occurs when there is too much insulin in the body and not enough glucose. Insulin shock can be caused by administration of too much insulin, skipping meals, and unexpected or unusual exercise. If we go down to the next paragraph, you'll highlight that a diabetic coma, diabetic ketoacidosis, occurs when there is not enough insulin in the body. On page 815, doubtful situations. Highlight the following. If you are ever in doubt as to whether a patient is developing insulin shock or diabetic coma, give sugar, even though the final diagnosis may be diabetic coma. This is because insulin shock develops much more rapidly than diabetic coma and can quickly cause permanent brain damage or death. All right, guys, that completes chapter 23. Again, please, I cannot stress this enough. Read the entire chapter. Look at all the figures. Look at all the case studies. Ask yourself the questions. What would you do in this case? What would you not do? Make sure you review the medical terminology.